Hello, and welcome to Drug Talk. I'm Matt Hamilton. Today we're talking about how antibiotic drug errors can cause Stevens-Johnson Syndrome and toxic epidermal necrolysis. Joining me is Dr. Jesse Garcia. Welcome, Dr. Garcia.
How are you doing, Matt?
Dr. Garcia, for our audience, what is your area of specialty?
Well, Matt, I'm a clinical pharmacist. I specialize in drug interactions and those interactions and those effects on the human body.
See, as you may know, I'm Matt Hamilton. I'm a drug error trial attorney. I represent the victims. Dr. Garcia, antibiotics are commonly prescribed. Do some people have allergies to those antibiotics?
You can. It could be just from the structure itself, or the medication just causes you to have some type of reaction. In some cases, it's as simple as a rash, while in other cases, it can just be as severe as anaphylaxis. Basically, you stop breathing because your throat swells up.
So anaphylaxis is an allergic reaction to an antibiotic, and it's basically causing your throat to collapse and you can't breathe.
Correct. And the secondary reaction that could come from that would be Stevens-Johnson Syndrome, which is basically a sloughing of the skin as you get a rash that begins on your chest. And you can, the viewers can refer to the YouTube video that we have posted on Stevens-Johnson's, which will go into that in much more depth.
Yes, we have 2 videos on our YouTube channel, which should be available also on our website, worldwideweb.law-kc.com, where we explain Stevens-Johnson Syndrome, toxic epidermal necrolysis, and also the errors and harms from that. Basically, Dr. Garcia, what is the true harm of Stevens-Johnson Syndrome?
The true harm is the body's basically turns into a rash. So you'll see that there's a rash that starts on the chest, neck, and then stemming from that, you are going to have some problems with fighting off infection. You won't be able to maintain heat because the skin is essentially sloughing off almost like sheets of paper.
Okay. And this can lead to very chronic harm and actually even death.
Correct.
Now,
so that's why these allergic reactions with these antibiotics, several different classes of them, are so important.
So let's talk about how an antibiotic allergy can be caused by this. What type of error can a medical professional make that would cause this allergic reaction in Stevens-Johnson syndrome?
Okay, so first thing is a known allergy. So you may have taken an antibiotic, you might have taken amoxicillin, penicillin, could be zithromycin, whatever the case is. You take an antibiotic and you've had a reaction. That reaction is documented at the pharmacy and it's documented at the doctor's office. Okay, then you're prescribed a medication that falls within that class. That's the first one. Basically, the pharmacist or the physician or the nurse practitioner, the provider, has just flat out missed the fact that you're allergic to the medication.
It's in your file and they just fail to see it.
And they just fail to see it, flat out.
Okay, and they prescribe it to you. They're not supposed to, and as a result, you get Stevens-Johnson syndrome or toxic epidermal necrolysis.
And also, in some cases, anaphylaxis.
And anaphylaxis. Okay, so the first error is just failing to spot it whatsoever in the record.
Correct.
What other sorts of errors can happen that would cause this problem?
So the second error is going to be a situation where we know that there is an allergy, or the prescriber knows there's an allergy and prescribes the medication anyways.
So they've seen it in the record, it's documented in the record, and they just do it anyways.
Correct. And part of that is they may not have probed the patient enough to know whether or not it's a severe reaction. In some cases, antibiotics are rough on the stomach and can cause some diarrhea. And so patients might say, well, I'm allergic to that medication. And so that is different, obviously, than a true allergy. And so they want to be mindful to ask what reaction took place. If you had anaphylaxis or you had swelling of the mouth with that antibiotic in the past, obviously it's not one you want to use again.
Okay, and they're just using it anyways, and they shouldn't be.
Correct.
Okay. Is there a third type of error that can cause this sort of problem?
Correct. So there is a third error that can happen, and we'll use the example of amoxicillin, which is common penicillin, and Keflex, or which is a cephalosporin. Okay, cephalexin is a generic, and so they are closely related. And in some cases have cross sensitivity. So what that means is that if you're allergic to amoxicillin, you could potentially be allergic to Keflex or cephalexin. Okay, so it might be documented in your profile that you are allergic to penicillins. The prescriber sees that and chooses Keflex instead of another option. Okay, as a result, you take the Keflex or the cephalexin, and then you have a allergic reaction.
So in essence, the medical treatment provider has seen the allergic reaction to it, has changed you to a different antibiotic, but when they changed it to a different antibiotic, they changed to one that causes the same problem.
Correct.
And they should see this, they should see that it's in the same category and not do that.
Yeah, if you've had that much of a sensitivity to the amoxicillin, that's one of the cases where you need to probe and say, okay, what was your reaction? If you had sensitivity, you had a really bad reaction instead of a side effect of the medication, which those are completely two separate entities, you can just pick a different antibiotic. There is plenty of antibiotics out there that will treat the same things that amoxicillin will do.
And a medical professional should know the difference.
Absolutely.
Okay. Well, Dr. Garcia, it's been a pleasure talking with you about these three types of allergy reactions to antibiotics that can cause Stevens-Johnson Syndrome and toxic epidermal necrolysis. These are deadly conditions. It's been a pleasure speaking with you today. If you want further information, I direct you to our website, worldwideweb-law-kc.com. It's got a lot of really specific information on these types of problems and how to look into it. It'll assist in your research. Also, I'd encourage you to go to our YouTube channel. Also, there are links on the same website. We've done a number of Stevens-Johnson Syndrome videos, and I think they'll assist in your research. It's been Drug Air Talk. I'm Matt Hamilton. Thank you for joining us.